the FFT foster care program, starting with assessment and treatment planning, specifically focusing on engagement and motivation, helping stabilize placements, and then systematically focusing on reunification and successful permanency. Let's take each of these phases for a moment and do a brief overview. The assessment and treatment planning phase has to do with bringing together both the information and the individuals involved to get it off a good foot, get a good start on the treatment process. There's usually an orientation or intake meeting. That intake meeting has the initial assessments that occur and an introduction to the FFT foster care program. This is done with the youth, the foster care parents, and the permanency parents, either in a combined meeting, individual meetings, or usually with the youth and foster parents and simultaneously with the permanency parents, if that option is known. Once assessment and care coordination is done, the engagement motivation phase of the model begins. Now remember, this is through conjoint discussions between the youth and the foster parents, led and organized by the FFT foster care interventionists. And the goals are very clear. First, through these 1 to 3 hours of discussion, we want to try to develop shared expectations and goals for the placement. And what's really important here is to remember when we say shared expectations, these are not any expectations or just the expectations of the foster parents. These are expectations of the model, which is that the focus of attention will be on how they work together and how they work together in an alliance-based way. So much of the developing of shared expectations is also helping the youth and the foster parent develop core and common expectations with the model. Second, using reframing and some of the other techniques of FFT, the FFT foster care interventionist will help create a family-focused, what we call relational theme or family relational trauma narrative to try to talk about the different things that went on with the youth in getting to the placement. Now, what's really, really important is that this gets framed in a relationally safe way. It gets framed as a relational struggle, and it's an organizing theme that's focused on them being able to work these struggles out and helping to match relational functions between them. Third, the outcome of this phase is actually a collaborative, not plan, but a collaborative agreement between the youth and the foster parents with clear goals and roles. 4. One of the outcomes we're hoping for is engagement. And what I mean by engagement is it's the very same engagement that functional family therapy seeks to develop. It's engagement with the youth and the foster care parents, that they're part of both the success of the youth and the placement, that they're both in it together, that it'll take both of them to work it out. Which leads us to 5, another outcome, meaning that if that kind of engagement can be developed, we're hoping that the foster care parents and the youth feel motivated not just to try, but motivated to try in a way in which they know they too will have to change some of their behaviors. And then last, of course, out of this phase will be additional assessment and treatment planning, trying to identify any additional youth psychological needs or family risk and protective factor needs that may be there. Now, just like FFT, there are some very specific skills that are related to this. And there's some very specific activities that go on this phase. As I've already said, there's these conjoint sessions between the FFT foster care interventionists and the youth and foster parents. 1 to 3, 2 to 4 sessions focused on accomplishing the goals that I just outlined. The outcome of that is a collaborative agreement between the youth and the foster care parents about how we will work together. Secondly, we know that there's also the task frequently of monitoring the permanency plan of the parents. That's either through check-in interviews, contacting the state, or actually working together with the parent. That will also occur. And then lastly, we also know that an important role in any foster care situation is helping both foster care parents and youth with instrumental needs. Whether those instrumental needs are related to school assistance, whether they're related to housing and food, whether they're related to rides. So in this particular phase, The foster care interventionist and the case manager will help provide those instrumental needs and also help develop the capacity and the empowerment of the foster parents to do it as well. As I said earlier, one of the important outcomes of this phase is what we call a collaborative agreement. And this is the outcome of these sessions, and it is an agreement that's intended to refocus the struggles, the difficulties, the challenges that the foster parent and the youth will have in terms of looking at what we're going to teach you to call problem definitions, and to turn those from blaming ones and negative ones to help the family stay family focused, meaning that they're all in it. We want these plans to be future oriented, not past oriented, but what we will do, not what we should have done. Agreements like this should be thematic and functional, meaning not details of exactly what to do, but more ways in which the youth and foster parents will approach one another. Family focused in the sense that it's about all of them. And the treatment plan's overarching goals are really this. It's much more than just a contract. It is also a technique and a way to build the alliance between the foster parents and the youth, to create a family focus to what they're doing so that they're all in it together. And it makes that in a very concrete way and these thematic kind of approaches. It also becomes a shared contract or a shared agreement that can be used to come back to in the stabilization phase, and it's family-wide in terms of its agreement. In the stabilization phase, this occurs as the collaborative agreement is developed. This is where the FFT foster care interventionist steps back. They step back and play much more of a monitoring and problem-solving role. They let the relationship, increasingly stable relationship between the foster family and the youth, be the curative mechanism that on a daily basis helps that youth overcome some of the traumatic kind of reactions that they're having. And the goals here is that the foster placement in which the youth is that they help monitor and supervise the youth in their adjustment to family and school, and that becomes your goal. Your goal becomes to watch, help, and step in when you need. Our goal is to help develop that foster family relationship to be one that's functional and very alliance-based. Try to use that functionally oriented perspective in a way that matches what we will call the relational functions and attachments between the youth and the foster parents. And try to help those relationships be the foundation of working together, first finding the noble intention behind the behaviors of each, and then using specific pro-social skills to work those out. And along the way, the foster parents, before they begin, and in a support way along the way, will be trained in the FFT foster care model too. We have a three-session training program that they'll also go through. So what that means is you, the foster parents, and the youth will all be on the same page for the roles that are required to create stability in the everyday relationships between them. Now, when you serve as a problem solver, there are a number of intervention tools that come from FFT that are very useful in this particular phase. And these are skills that you're going to see later on in the training program connected to your training in basic FFT skills, and also your training in terms of specific FFT foster care skills. First, both through engagement motivation and the stabilization phase, you use reframing to take difficult things that are said and redirect those things to try to find the noble intention in a non-blaming way. It becomes important and a useful tool to take a concern that someone has, be it a foster parent, be it a youth, and think of it as a problem definition, and to try to take that problem definition, which is frequently attributed to another, and help refocus that on the individual to help develop responsibility. Number 3 is from those reframing interactions to develop an organizing theme or a family narrative to explain why they're there, how to understand the behaviors that occur, and this will help focus again on bringing the trauma into the foreground to help them contextualize the events and the behavior of the youth. One of the important skills in that for both the youth, the foster parent, and for you is to find the noble intention of behaviors and the interactions within the family that will help bring about motivation and negativity. And that usually comes from everybody's behavior as being seen as not necessarily good, but everybody's behavior being seen as something noble in its attention. It's important to separate blame from responsibility. We will teach you through reframing and a way to do that. And we're going to teach you ways to help align and identify the relational functions between the youth and foster parents so that we can create matching and safe attachments that will last. Now, the way this works functionally is in this particular phase, you're going to meet with the family as required monthly, but you're also going to monitor their behavior, monitor the progress and the alliance between the family members and school. We're going to monitor those through our FFT clinical feedback system, and we're going to monitor it through by checking. So you'll have access on your computer to the current real-time status of the youth in school, at home, and in their behavior. That, in addition to what you see and find when you go, will allow you the opportunity to intervene maybe before they even complain and ask for your help. It's intended to help you intervene early so that problems don't become difficult and so that the stabilization of the placement doesn't come into risk. Now, again, those are done through conjoint problem-solving sessions. Now, again, what's important here is that FFT brings a family focus to this, so conjoint is really important, meaning working together with the youth and the foster parent to help work out these particular issues. In the last phase, when a permanency situation either emerges or a permanency situation develops, you will help the youth and the permanency family unify in a way that's intended to create stability so that even the best intentions of the permanency caregiver and the youth can be realized by first helping them develop a family-focused level of engagement, a family focus to behaviors, safe patterns, and a reduction of blame and being able to put it in a trauma context to really understand each person's behavior. Secondly, with very specific tools in terms of conflict management, in terms of problem solving and communication, you're going to help them then use everyday tools, conflict management, problem solving, communication, to solve daily problems. And then finally, before you're finished, systematically helping them generalize those skills to other areas, help maintain them through the up and down that will be normal, and then help identify external supports that may be needed by the youth, by the permanency family. And the idea here is through regular conjoint discussions that your focus is on helping them unify and develop a stable pattern of working out everyday problems. Now that's going to occur in this last phase through 6 to 10 systematic conjoint sessions that you'll have, stretching over a period of time where you'll accomplish the goals of the particular phase. And all along, you're going to also continue to be able to monitor how it is going in the permanency family by looking at real-time measures of impact, progress, and symptoms. You can also continue to monitor the permanency parent plan, and you can monitor and continue to look at school behaviors along the way. In the last phase, when a permanency situation either emerges or a permanency situation develops, you will help the youth and the permanency family unify in a way that's intended to create stability so that even the best intentions of the permanency caregiver and the youth can be realized by first helping them develop a family-focused level of engagement, a family focus to behaviors, safe patterns, and a reduction of blame, and a being able to put it in a trauma context to really understand each person's behavior. Secondly, with very specific tools in terms of conflict management, in terms of problem solving and communication, you're going to help them then use everyday tools, conflict management, problem solving, communication, to solve daily problems. And then finally, before you're finished, systematically helping them generalize those skills to other areas, help maintain them through the up and down that will be normal, and then help identify external supports that may be needed by the youth, by the permanency family. And the idea here is through regular conjoint discussions that your focus is on helping them unify and develop a stable pattern of working out everyday problems. Now that's going to occur in this last phase through 6 to 8, 6 to 10 systematic conjoint sessions that you'll have, stretching over a period of time where you'll accomplish the goals of the particular phase. And all along, you're going to also continue to be able to monitor how it is going in the permanency family by looking at real-time measures of impact, progress, and symptoms. You can also continue to monitor the permanency parent plan, and you can monitor and continue to look at school behaviors along the way.